Okay, as you noted from the agenda, we have kind of a diverse approach today. Two very different concepts, but both very welcome to the ecosystem for digital health in the Kansas City area. And for our first presentation, we'll look at a new center that's being developed at UMKC. And our presenter will be Dr. Jerry Wyckoff, professor and chair of the Division of Pharmacology and Pharmaceutical Sciences and director of research and graduate studies in UMKC School of Pharmacy. So Dr. Wyckoff, if you want to proceed, that would be great.
Wonderful. Can everybody see my screen?
Yes, it looks good. Perfect.
Great. So I appreciate the opportunity to discuss this, and I hopefully will spark your interest in what we're trying to do here. I think John's giving me a little bit too much credit in calling this a center, but we're gonna talk about what we are doing here. So I am, as noted, in the School of Pharmacy at UMKC, and we have a little bit of lab space that we are essentially hoping to rent out to small businesses that are looking to get started and need some lab space. We've actually been working on this with our tech transfer office, Eric Anderson. We had to get all of our documents approved through University System Legal, and those of you who've worked with universities in the past know that that's not always a quick process. So I very much appreciate his help. So the idea here is that we're going to rent small amounts of lab space to small businesses. We have a lab that used to be used for a course that we no longer teach. And because of that, because of its location, we feel it's a good use of this space to foster collaborative research work at UMKC in the Health Sciences District. The lab itself has a common space and then 5 small locked rooms that are off of it. It has door closers, sinks, it has electrical power. There's some of that power is actually on generator power, so that way you wouldn't lose access to power even if there's a power outage. We have internet there as well. It's first floor facility. It's actually near the dock for the building, which means it's relatively easy to receive items in, and as well, it's actually near our animal facility as well. Now, because of the nature of the space, I'm not going to tell you that it's luxe. It's definitely not. It is not purpose-built for innovation. It is not meant to be an incubator. It is really space that we feel could be useful for businesses that are trying to get access to lab space that don't have it. And we know that there's a premium on lab space in Kansas City and in the region at the moment. Part of my disclosure is that I also work with a company called Air Pharma. They're currently out in Olathe in the old KBA building. And I also have a small business myself called Zorilla Research, and we've had trouble getting lab space in the region as well when we were trying to get that. So we know that there's a premium on this kind of space. We have facilities to receive mail. We have autoclave access, which is actually pretty important if you're trying to do any biological work. There's potential for people to have stericycle access as well. There's a potential for fume hood access, which if you're trying to do certain kinds of chemical reactions, you're going to need that. We have some shared systems, including negative 80-degree fridges and freezers and things like that. There's a potential for more bench space here as well that's up closer to our mass spec facilities if there's a need for space that where you might need to do a reaction and then get a reading off of it. Either we have a flow cytometer, mass spec, we have zeta sizers and other kinds of equipment that we can potentially negotiate access for as part of this space. We do have the ability to have virtual space as well. We can potentially work with people in early phase work where you have a mailing address and access to common space with some negotiation there. We know that this is something that is often necessary for people, especially when they're trying to get SBIR or STTR grants. That's one of the things that we are really excited about, is the opportunity to work with companies that might be looking to get these small business innovation grants or these tech transfer grants. Because of our access to mass spec and other facilities, our animal facility access, potentially the ability to collaborate with people to work on projects that would need IRB or IACUC approval, we feel that the group of faculty that we have here, not just in the School of Pharmacy, but on Hospital Hill and in the Health Sciences District, we feel that this might be something that would be a boon for small companies that are looking for potential access, not only to space, but also to the kinds of people who would be able to help with the problems that small businesses often have when they're trying to scale up. In my division, we have faculty who work on everything from drug delivery to novel antibiotics. We have a host of graduate students that are interested in projects. Many of them would be potentially able to collaborate. We also have PharmD students who are often looking for summer projects. And I think that kind of environment, along with, School of Dentistry is right there, medicine's right there, nursing's right behind me. I think we've got the right environment for small businesses to come in and be successful with these kinds of grants in a collaborative environment. So we really are trying to be part of an ecosystem for innovation. Like I said, we've got our students around as well. You have access to faculty collaborators. If this works, part of what we're hoping to do is maybe do monthly or quarterly meetings of companies that are in the building, just to try to, build up some camaraderie for the people that are around. And we really do feel that there's a lack of lab space in Kansas City that needs to be addressed. And we hope this is a marker that lets us start to address that and hopefully build some momentum for addressing this in a more permanent way in the future. That's all I got. So it's a pretty short presentation. So I really have lots of time for questions. We work our leases through the tech transfer office. There are costs and access and things like that. I didn't want to put all that in here because there's a little bit of there's a negotiation when we have to do this. But again, we do have all the paperwork vetted through legal. So I think we're in a pretty good shape to do this. We have a company that's looking at us right now. We're hoping to get that lease signed soon. And we have another small company that's looking for access to the space as well. There are faculty here who are looking to potentially also lease space to move their own projects that are licensed from the university further in the future. So we're hopeful that we'll have an ecosystem here soon. I think in our ideal model, we'd have businesses here for 2 to 3 years before they scaled out of the facilities that we had available. And so we'd have some turnover, but we'd hopefully have a group of people who've kind of been through early stage and sort of, middle stage work with their companies. So with that, I'm happy to take questions. I'm happy to talk about the space hopefully spark some conversations.
This is really great, Jerry. Thanks so much for sharing it with us. I was wondering, I realize that you're probably not, as you said, not really in a position to discuss costs and access at this moment, but there are two kind of challenges that innovators run into when collaborating with universities, and that's the overheads that are associated with it and the intellectual property that are associated with the work. Have you thought through those kinds of things, and is there anything that you can share with us so far?
Yeah, so there's two pieces I can talk about. So if pretty much all you're doing is leasing space, the way that we've written the leases up is that there's no the university has no claim to intellectual property for that company being brought in. So there's no encumbrance of that. Secondly, the overheads are incorporated into the negotiated lease price. So it's not like you're getting dinged on top of that. Now, that changes if there's collaborative work. If you're going to collaborate with the researcher here, then we have to collect our full overheads. But on the other hand, if you're writing an SBIR or an STTR grant, you can build those into the cost of those grants. So we hope that that's not too much of a barrier to entry for folks.
Okay. Other thoughts from the team?
Hey, Jerry, this is Dick Flanagan, and it's very creative. Thank you for doing this. I think that while this is not an area of lab space that I would proclaim any expertise on. I do know that down at the Next Gen Precision Health in Columbia, lab space became a critical part of what they were doing to attract both faculty and small business. So it's really cool to see that kind of capacity being made available here in Kansas City. The thing that I would love you to keep an eye on, and this is really a digital health thought, is the new campus that's going to be built and the money's being raised. And I had a chance through some of the board stuff at UMKC. We need to get space for digital health companies on that new campus. And I would just ask those of you affiliated and working with the state and the city and the county, let's keep an eye on, you talk about collaboration and the collisions that can take place. I think for digital health broadly, it's a really good time to think about how we bake ourselves into that new space and that new campus and the whole health sciences district. So it's really more of an offshoot, and compliment you for doing this, but then let's think broadly about how we create a common place for collaborative space on that campus. So good stuff.
I appreciate that comment as well, because I think that's something that really does need to stay front and center. I'm going to say it's challenging for me as a faculty member, as a mere faculty member, as a mere mortal, sometimes to get the concerns that need to be addressed up the food chain. And I think there's sometimes a lack of awareness of what the region needs when we talk about buildings and space, that, it's just as important to have small businesses who may only need, access to some co-location facilities, but we need to have that, or those groups can't move forward with their projects. And we talk about fume hood access, and I suspect that there are a lot of companies out there that have stuff that they need to do, that they need fume hood access for, but that is a very difficult thing to get a hold of on a temporary basis. If you need it for just a couple months, or even if you need it for the duration of the phase 1 SBIR. So that's the sort of thing that when you're thinking about what do you need to have an innovation ecosystem, those things, as you point out, need to be baked in. And from a digital health perspective, oftentimes what's lacking is some space where you can go that has stable internet, right? Or, space for you to just have some meetings with potential investors. And those are the sorts of things that are hard. I know that stuff like that exists around, I get it, but especially in right here on Hospital Hill, I think we have an awfully good opportunity to try to make a difference. So I really appreciate that.
Yeah, that sounds great. Thanks, Dick. Other thoughts? I think this is a really cool opportunity. I wonder how the group responds to this. Jeff, do you want to go ahead and ask your question, please?
Oh, I'm sorry, I thought I was on mute.
Okay.
Hey,
Oh,
Gerald,
I
was just asking.
About Medicare lease spaces?
Yeah.
Well, our space, talk me through this, because I'm not sure that I understand the question.
So it's my understanding as a current provider of Medicare services, we cannot also lease space from another Medicare provider. There's some rules that are out there.
Yeah, but this is, I mean,
I could look about that.
I understand your point. This is university space. It's not university health space.
Gotcha. Okay.
Great
And then
question.
how that connects for research topics there. That's something I've been struggling with. We're in a position where we could be enabling some research right now, but we haven't found a principal investigator to work with. Is there opportunity to work with you guys about and help identify potential researchers?
I would, yes, absolutely. And that's, I mean, part of my job as director of research for the School of Pharmacy is to try to make more research happen. And that's when I was hired, that was made very clear that, so I would love to make introductions. And if the people that you think you might need aren't in my school, I've been at UMKC for 20 years. So if I don't know them, I can find somebody who does. I'm pretty convinced. So I'm happy to make those kind of introductions, whether that's, if you have a project and you're looking for somebody, I'm happy to try to make introductions.
That'd be great. Thank you.
Yeah, of course.
So Jerry, is this kind of complementary to what's happening at Free Enterprise, the Plaster Free Enterprise system on the main campus? Is it, I mean, because I know they do a lot of SBIR and STR, and they have some different, not lab, I mean, they do have, you know, some lab space available for use. And
Yeah, I think complementary is probably, I've been trying to work on this for about a year now, right? And the Plaster Center's been in planning for a long time.
Yeah.
The issue that I see is in the Plaster Center, they don't really have the kind of facilities that if you're trying to do, you know, chemical or biological stuff, there's nothing there. So I think it could be complementary. I think it's possible that people need both the computational resources that the Plaster Center would offer, as well as the kind of facilities that we offer. But having said that, there's no formal mechanism to tie them together. But that maybe is just because for right now it's easier for, and I hate to say this because I really don't like silos, but in some respects it's a little easier for us to get this pushed through in our silo than it is to try to knit something together across the campus. Yeah, it starts getting complicated the minute that money's going in multiple different directions.
I understand that.
So, Jerry, how ready are you to take on someone? Are things a go right now?
Yeah, I mean, we've got the leases are ready to go. So the big issue is, what do you need? So this is where it gets a little bit complicated. We had somebody come in and say, I need this, that, and the other thing, and I need this stuff moved out, and I need these cabinets ripped out. That's a little harder because then I have to go through CFM. And if you've, like I said, if you've ever worked at a university or worked with a university, you know things can move at the speed of molasses. If you come in and you see a space and you go, oh, that's fine, I can move my stuff in here and lock that door and use this cabinet. Yeah, then you can start tomorrow as far as I'm concerned. Well, Eric would probably tell you can start January 1st, but we're ready to go.
That's great. That's great.
Gerald, I've got a question.
Yeah, please.
Do you work with like Pulse Design Group when it comes to configuring your space?
No, there's no design group. There's no configuration of this. The space exists. And if somebody needed some extensive work on it, we would have to figure out a way to fund that. And I don't even know that would be possible. There is, how am I going to put this? There is a potential, and this is something that, you know, I'll put this out there only because I think it's important for this group to know that. I don't know how many of you have been to sort of the School of Pharmacy, if you've been in the campus. You know, there's an amphitheater that's sort of an outdoor amphitheater that's south of the School of Pharmacy and School of Nursing. So there's that lawn that's right there. So that lawn, if you're by Diastole or sort of if you're over by the Antler Room, right? Some of you might have been over there. So if you look at that corner on the south side of the building, there's a big sort of open space with rock amphitheater. It's really pretty. We use it for our hooding ceremonies when we have to. Below that is shelf space that's unfinished in the building. It's been sitting empty for 14 years. So those of you who have been in Kansas City for long enough know that this building used to be just basically a big open parking lot space next to the School of Dentistry. And so when they filled this in, there's this big retaining wall along the street on two sides, and then the animal facility is on the other side of it. Well, they didn't finish about half of that space. So behind the lab space that we're talking about is this large unfinished space. You could literally, you could fit a whole basketball court in there if you wanted to, with room for spectators. Long-term, big picture, I would love to see that space finished off in a way that was complementary to the kinds of things that we're talking about in terms of, you know, small batch production of chemicals, GMP chemicals for, you know, preclinical trials, things like that. That's the sort of thing that in my head we will do there. But again, I'm a small cog in a big machine. But my hope is that by having this start and with that behind it, maybe there would be potential to finish that space out in the future in some sort of public-private partnership. That's not on the radar right now, but if I have my druthers before I retire, that will happen. And since I got about 12 years before retirement, wish me luck.
Good luck.
Thanks.
Any other thoughts?
Okay, well, if anybody has any questions or if you want to talk about this, you got my email. If you look me up, it's not hard to find my phone number. Everybody else seems to have it, so I'm happy to talk about it. Okay,
Yeah, absolutely, Jerry. Thank you very much. And
thank you.
It's clear that you have your finger on the pulse. So it's great to hear it really kind of from the source and to know really what's going on. So much appreciated. Thank you.
No, I'm happy to help.
I had one question that I was thinking of how to phrase it. If any of you been down to Wichita State, they have an innovation campus. Is this something like what you're anticipating this to be? Because that's an area where people can come in and rent space, and they have access to large 3D printers and other types of shared industrial and as well as laboratory equipment, also other labs with high-tech visualization devices that can be shared with the person there.
I think if you take that and scale it back and make it such that the space is here, it is what it is, but the people here and the resources that we have, I think that we can do more with them. And what I'd like to see is that we're driving people to use the equipment and the expertise that we have more than they're being used. And trust me when I tell you, my faculty will tell you they're fully booked, but they're not, right? I mean, there's always room for more work, I think. And so my hope is that what we're really doing is starting the curve towards something that could be like that. I don't think we have the space here to do all of that, right? I mean, besides maybe there's some unfinished space and stuff that we could do long term. But what I believe is that if we don't do something to show that we can get this ball rolling down a hill, nothing will ever move. And again, I've been in academics long enough to know that unless you start pushing that ball, nobody goes anywhere. So the hope is that by getting people in the building and by showing that we can collaborate, people are using the instruments more. We already are working with some companies locally who are using like our flow cytometer on a regular basis, our Zeta Sizer, things like that. My hope is that by showing that we can successfully do that, and that when people are in the space, it makes a difference in the community, then people will know that we need more of that space. Because I think that's what is lost in some of the conversations that I'm in, is it's almost like, well, there's space, people will find it. And that's not, honestly, it's not true. And it's one of those things that I keep hearing over and over again, is that we'd have a lot more small businesses in town and who would stay in town and who would be building facilities if they could get through that hump of, I need to move out of Kansas City to find a place to grow my business. I don't like that. I don't think any of us like that. If we could actually get a couple of businesses who grow from, tiny to, mid-sized by growing through these incubators, I think we'll change the conversation. Then maybe we can have this argument of, hey, I'd rather see space that's up here on Hospital Hill, or at least in the neighborhood, because that's where, let's face it, that's where the patients are, that's where the need is. I look at my office overlooks Troost. Okay, it's right behind me, and that is a divide that we still haven't gotten through. And I don't understand that. There's space. There's places that we could bring people in, and we could employ more people in the community, and our students could interact more with the community. And our healthy Kansas City East Side, which Jeanette Berkeley-Patton's working on. Those are the sorts of things where, and if you don't know about that, you should have her come in and talk about it, because it's a great initiative. The kinds of work that our students are doing in the community, the dental school with their outreach, medicine and pharmacy and nursing with their outreach. This is the sort of stuff where if we had small businesses in the mix, we could do a heck of a lot more than we're doing. So I'm kind of an evangelist for exactly what you're talking about. I just don't know that we have the resources to do it right here yet. But my hope is that by getting something small up and running, people go, oh, that works. And then somebody more competent than me will take it over and push it push it a lot further, because that's what needs to happen. It can't just be, it can't always just be, you know, you catch as catch can, which I feel like it's been. So that's my plea. So thanks for the questions. Wow, I just put my heart right on my sleeve there. You can all see what's going on.
Well, we love the passion. That's really makes the difference, frankly. And also, thanks for raising the Our Healthy Kansas City East Side project. We definitely will have Dr. Berkeley Patton in to speak, because KC Digital Drive is actually participating in that grant. And so we'll be doing things with outreach about digital inclusion, as well as some activities within health around diabetes and about reaching people in the home with digital technologies.
I appreciate that. And I will tell you that part of the reason why this idea started was because way back in 2020, I can't believe I can say that, but in the early part of the pandemic, when it became clear that the mRNA vaccines might actually be the ones that won, we figured out a way to get our negative 80s hooked up to monitoring and everything else so that we could actually use them to store vaccine. So that was when people were out in the community doing some of that vaccination early on. Those vaccines were actually stored down the hall from me. And so the idea that we can do that and make a difference in the community, that was what led to this idea of, wait, what else can we do? And what other kinds of impact can we have that, and so that's when this space, that course got cut because of the pandemic. You can't run a lab, and then we had a declining enrollment before that. So the whole thing kind of came together in part because of this idea of what are we going to do to help the community when we're going to have to do large scale deployment of vaccines. I was really frustrated because I spent, well, not me personally, but like the school spent a bunch of money trying, getting those things set up. And then it took a long time to get people to realize that it might actually be worthwhile to have a university that can store vaccine in their freezers. In a school of pharmacy, right, where we have the vaccinators right here. And so the fact that that worked, but it took us a while, is what led to this. And it took a while. So yeah, I think I tell people that I think UMKC has a social justice mission. And if I say that to the wrong people, I get yelled at. But I think we do. We're a public urban serving research university. That is how Leo Morton used to put it very nicely. And I believe that part of that means that we have a responsibility to make sure that the community is not just healthy, but has opportunities to grow. So that's where we're coming from. And so, yes, please have her in more to talk, because she talks about it much more eloquently than I do.
You did very well. Thank you, Jerry. We've had a few people join us since we kicked off. Might allow them to introduce themselves. We had a really great question from Jeff. Do you want to introduce yourself, Jeff? You're on mute.
Yeah, sorry about that. Yeah, Jeff Blackwood with New Frontier Mobile Diagnostics. We founded the company to bring access to imaging care into rural locations, healthcare deserts, and really try and bring about health equity when we're talking about things like echocardiograms, women's health, those sorts of things. We provide on-site diagnostic imaging services.
Great, thank you. Paul? Paul?
Hello there. Paul Bushore with Mid-America Regional Council. I'm a data analyst within the Research Services department here, work with Frank Link and everything, and just listening in here. Thank you.
Great, you're very welcome. Dennis?
Hey, good morning, everyone. I'm in the car, so I'm off video, and I am parked right now, but Dennis right now, our president and CEO, BioNexus KC. Thanks, John.
You're welcome. Is Daniel along as well? Maybe not. Any others who joined us since we kicked off that we could introduce?
Hi, I'm Ashley. I'm a clinical informatics nurse at North Kansas City Hospital.
Great, welcome, Ashley. Okay, with that, I think we'll go ahead and look to our second presenter. And to me, this is a very exciting space because it's something that many of us deal with in our regular jobs and care deeply about, and that is how to address social determinants of health. And for within that space, we have a really new and interesting approach represented by Emily Brown, the founder of Free From Market. And we welcome her to present her view of how to get healthy food to people who need it. So Emily?
Hi, thank you. I'm going to share my screen here. Let's see, can everybody see?
Yeah, perfect, it's great.
Okay. Before I jump in, I'll just give you a little bit of background about me and why I started Free From Market. So I have 2 daughters that have chronic conditions where food is part of the standard of care. And about 9 years ago, my family was really struggling financially, like many Americans do. We were on WIC, we were on SNAP, and we couldn't get the foods that we needed to keep our daughters healthy. And so initially, I started a nonprofit to get special dietary foods into food banks and to food pantries. That nonprofit is still growing, still doing well here in Kansas City. And, you know, through that experience, I've had an opportunity to become a co-investigator on food-related conditions and food insecurity with top research institutions. I became really interested in healthcare quality. I care deeply about health equity, serve on a number of hospital committees at Children's Mercy, very passionate about health equity, particularly in the pediatric space. Have done some quality work with the Children's Hospital Association, and really just saw this shift in healthcare, the rise of social determinants of health and value-based care. And so really wanted to take the work that I'd done and really take it to scale. I saw many challenges navigating a community organization working to address this. And so launched Free From Market in 2021, really to make sure that everyone has inclusive access to not only the food that they need, but the resources and support they need to make long-lasting change. And so Free From Market really is just this platform that is really meeting kind of this time in the market. So there's a lot of forces that are kind of pushing food as medicine to the forefront. And so I'll talk about kind of what's shifting in healthcare first. We see the value of food as medicine and access to food insecurity and basic needs written into 34 states requirements on their Medicaid contracts. You know, mandatory SDOH screening starts in 2024 with the new CMS quality measures. There's been an increase in 1115 waivers for Medicaid innovation. We see that adopted in Massachusetts, Arizona, and Arkansas is pending. So there's going to be more value-based care. It's accelerating. And we all know that nutrition lowers the cost of care for patients who don't have access or knowledge. And so Free From Market partners with both community-based organizations, health systems, and health plans to really address this new challenge. Free From Market is one of the only Black-owned companies in this space, and it's really done through a patient-led approach. My co-founder and I are both involved in peer-reviewed research around quality health outcomes and the cost of care and that impact. Free From Market is a scalable, HIPAA-compliant, closed-loop system, which allows payers and patients and everyone involved, every stakeholder, to have access to their outcomes, data, and behavior. We are at the point of care. We work directly with one of the largest social care referral platforms in the country, and I'll share more about that in just a moment. But we can reach every zip code in the country, allowing equitable access for all patients. Our current adherence rates are above 80% month over month. So that means they're shopping every month, coming back to get the foods that they need and want. And over 30% are putting in their own debit cards, purchasing above their subsidized credit, which is, again, just allowing patients to have greater access to the foods that they need at the right time. And again, we believe that it's not just enough to have access to food, but having access to education and support is really what provides that long-lasting change and allows individuals to kind of meet their special dietary needs within their cultural context. So again, I've kind of gone over our mission, but we are a mission-driven company, and it's really at the heart of everything that we do at Free From Market. So 1 in 3 Americans has a chronic condition where food is part of the standard of care. And we know that 75 households earning $75,000 or less are really struggling with that consistent access to those food and resources they need. We know access is driven by affordability, but beyond affordability, we know that you may not even have the right foods in your community. And so we know that that's a barrier and often a challenge. And then adherence rates, we know pharmaceutical therapy adherence rates range between 30 to 50%. And so when the doctor says you must make a dietary change, how do you do that? Who helps you with that? And it can be very difficult. And we know up until now, there's been a lack of education around nutrition and medical school training. We know that's going to be changing with the new guidelines and standards coming out of the White House Conference on Hunger, Health, and Nutrition. But up until now, it's been a real challenge for providers to support patients with those dietary changes. And finally, we know there's been a lack of data for all stakeholders to really demonstrate the outcomes on addressing chronic conditions with food. And so Free From Market is really a kind of a total solution to help partners address the needs of their patients, whether it's from prevention and addressing food insecurity all the way to treatments and interventions. And so Free From Market's platform allows patients to come on and be referred from either their provider, their health plan, or community-based organizations that's subsidizing that credit. And with their credit, they're able to shop on our platform. It's the e-commerce platform. It's built mobile first, so it is web-based. It's not a separate app, but it allows them to come on, select the foods. We have over 2,000 healthy grocery foods that have been curated by our team. So there's no Frosted Flakes, there's no Cheetos, but everything on the platform, is healthy, nutrient-dense foods. We have major brands that you can find at your local Hy-Vee, Walmart, but also brands that you're not going to be able to find here in your local community. So there's that element of delight and surprise. They can filter through all the allergens and the ingredients. We've added additional ways to filter through certifications, and we're adding additional nutrition tags to further be able to help individuals get the foods that they need. And then it's delivered direct to their door. We are bringing fresh produce back onto the platform in January, as well as integrating medically tailored meals with our supply chain partners. And the produce will be sourced locally, but delivered nationwide. So we'll be able to support patients regardless of where they live. And I think one of the most important aspects of this is the fact that our system is closed loop. So we integrate our supply chain partners into our platform instead of passing them off to, say, an Instacart or an Amazon Fresh. And that's really important because while those companies have significant reach, particularly in urban areas, they may not have significant reach in rural communities, or the inventory or the grocery partners are not there because it's integrating the existing retail grocery infrastructure. And so we want to make sure that patients, regardless of where they live, have access to the same high quality inventory across geographies. It's also important to track data, which we know is essential. I have served on a committee where we're making referrals to pantries or to grocery stores with gift cards, and we don't know if they're able to receive the foods that they need, or if, or what they received in general. So we're able to pass that data back, not only on utilization, but on the consumer behavior insights, which is really important because it can then further drive additional change. We also are launching our education and coaching program out of beta in January with our first health plan. And that is providing both asynchronous and live content with a registered dietitian. It is based on increasing nutritional literacy, not just meal planning, and then unlimited tech support with a health coach. and recipes and content. And for us, it's important for everybody to see themselves and to have that cultural congruency. So we're not randomly matching health coaches and RDs. Our users are able to select the coach that they want to work with. And we think that's important because we don't want to match, a 24-year-old registered dietitian in San Francisco with a mom from the rural South who just don't have the same cultural context to food, because food is so personal and it's cultural. And so how it works is we're at the point of care through a partnership with Find Help today. Find Help is, again, one of the largest social referral platforms in the marketplace today. And we are one of only 2 food partners in their marketplace offering. And so it's free from market, offered nationally with GA Foods. And so again, that clinical partner submits a screener to determine eligibility. The referral is sent at the point of care through Find Help. That generates an automatic monthly credit on free from market. That member or patient can then shop the curated online grocery platform. And then we send back that information so that everybody generates that monthly report with essential data to close the loop on that referral and on that care. Again, here's just a snapshot of some of the products on the platform. But again, we have products across categories that allows individuals to get the foods that they need and want. And again, we're bringing produce back in January and also integrating medically tailored meals, because every once in a while you may need a meal. And so the way that our platform works generally is our partner sets that subsidized credit amount. Many of our partners are providing a credit of about $150 today. And so again, those members can shop and select the foods that they want within their prescribed dietary needs. Our nutrition program, again, is based on nutritional literacy, increasing nutritional literacy versus meal planning, really going over the basics. And then they work directly with the health coach so that they could have personalized approach, because we know that many of our users have, they may get referred to us because they have celiac disease, but they also have diabetes. And so they're managing multiple comorbidities at once, and then even more comorbidities when you think about how the family is eating together. So that health coach is really able to personalize the needs of that individual and help them prepare meals. And they know our platform really well and can make suggestions on items to purchase. And then again, it's delivered direct to their door. We are engaged in research. And so our initial set of patients on the platform we've done patients with food allergy and celiac disease, and we'll be launching patients with obesity with our first health plan. But we're engaged in outcomes research, and we just completed a study with Stanford, and this is just early analysis. We're still going through all of the data, but 50% of participants who participated in this study felt more like they were more confident in preparing healthy, safe meals for their child. Most of the participants were pediatric patients. 150% were more likely to report that they had education on how to read and interpret food labels, which is a key management skill when you're managing a food allergy. And we increased their food security by 75%. Additionally, those who participated in this study felt that the counseling services, so the nutrition counseling services, were essential. They enjoyed all the recipe ideas, and that the services were life-changing because they were able to then manage their condition. And I should note that this study had 80% Spanish-speaking participants. So our nutrition program is delivered in both English and in Spanish. Here's a couple of quick impact cases. Our first participant was referred to us again because they had food allergy, but then they had additional health conditions, high blood sugar, and other sensitivities. And through the program, they were able to lower their blood sugar and lose weight on the program, even though that was not our initial outcome. But it just demonstrates that there's spillover. So a patient can be referred to us for one thing, but having that nutritional literacy, that focus on the basics, really does help improve health outcomes over time. And our additional case study, this individual was referred to us on services for about a year. They lost their subsidy because they no longer qualified through our partner who was providing the subsidy. And within a couple of months, utilized care at a high level because the mom simply could not find the foods that they needed to keep the child safe. And so then, ultimately this individual was put back on services. The hospital said, we'll just pay for it because, they've expended a lot of uncompensated care simply because they don't have access to the right food. So this just demonstrates the real financial impact of being able to have access to the right foods at the right time and reducing care. At Free From Market, we want to be a part of this emerging field, not just in providing access and solutions, but really part of the discourse and the thought leadership. And so I am engaged at every level, continuing to do peer-reviewed research, as well as bringing key stakeholders together and discussing how important this work is from a patient perspective and integrating that lived experience into the work. And so we've participated in several conferences this year and will continue to be a voice in this emerging field. And you'll see I did receive funding from Google for Startups, their Black Founders Fund, and they've been great partners to really support and drive this work forward. So we've got a great team that has diverse skills from many different backgrounds, from healthcare to marketing and technical support, but we've got a great team that really gets the work done. And so I'll stop and take questions.
Oh, that's really great, Emily. Thanks so much for sharing that with us. I had a question, or I actually have several, but I'd like to open it up quickly to the others. You yourself are not operating as a not-for-profit, is that correct?
That's correct. So Free From Market is a for-profit company, but it is socially minded. So we have investors. We're venture-backed. Our investors come from both food and healthcare and social impact. So we are measuring not just financial returns, but we also are measuring impact returns as well.
Yeah, it's to have developed the partnerships that you have to pursue outcomes is really outstanding. I'm very impressed with that. Could you maybe say a little bit about your choice of name for the organization?
Yeah, so Free From Market originally, the word free from is really kind of a food industry term, like free from dairy, free from egg. We really, I have two daughters that have food allergies and one that has a rare disease where food is really part of the standard of care. So we have that kind of food allergy history. And so that's really kind of where the name came from, but I believe it fits even more. So it's free from, the things that you don't need, but full of all the things that you do. And so that's really kind of where the name Free From Market comes from. Although, we just had our Q4 board meeting and I think we actually are looking at changing the name, but for now that's the name.
That's great. Others on the team?
Yeah, I have a question, Emily. We've been running a social determinants of health survey on our patients that come in and have over 60,000 surveys in the last year or so that some medical students are looking at, and then making sure that that positive finding is reflected in the patient's problem list. How do we go about referring a patient to Freeform Marketing if we find somebody that qualifies?
Yeah, so we right now work directly with partners that are subsidizing. So, we would have to have a partnership with your institution, or, one of the health plans would have to cover it. So right now, the health plans that we're working with are actually not based in Kansas and Missouri. So we're actually launching with the health plan in Ohio and Georgia first, which is just the way that it has come down. But we would just have to have a partner that would provide a subsidy, and then you could refer those patients directly to us through Find Help, or we actually have a referral portal on our platform that we can do directly, but most of our partners leverage Find Help because it's already integrated into their EHR system, and it's just a 1-click versus a 2 clicks.
Hey, Emily, I'm really impressed with what you've done. This food is pharmacy and food is drug. And I know that's not the best way to say it, but the ability to prescribe food has been an idea that's been around a while. But it's been really hard to make real because you're sending people into traditional shopping environments with limited tools and limited information on packaging and all those kinds of things. So I think this is a really cool idea, and glad that you've taken the time to do it. I did have an interesting observation in some of the work that we're doing with early digital health companies is they find it difficult to get Kansas City companies to actually use their technology early in their life cycle. And you said something that just caught me. You said, we're going to Georgia and Ohio as our first plans. Is that what you said?
That is true.
Are you
Yes.
getting any traction locally in doing this? Is that a...
So I'm having conversations with health plans locally. We have not signed a contract with any of the health plans locally, although, we are in conversations.
Okay.
And I can tell you, as someone who has made Kansas City my home, it's a place that I'm deeply invested in. I just spoke, I think, on a panel a couple of weeks ago about how I think this dynamic comes from our, the history of the show me state, right? Go and get enterprise contracts other places. And then I think our companies will follow on. I will say it has been challenging to get that first large enterprise customer here, but I'm confident that we'll continue to do good work and that they will come along. And I think part of it is, we haven't expanded. We haven't expanded Medicaid in Kansas, but we did in Missouri, but it's still early on. Some of the other states are just further along in their adoption of integrating social determinants of health work. So I think there's a number of factors that are involved. Free from Market is really well positioned for the Medicaid market, although, we work with, health plans across the spectrum, but I think with our history in pediatrics, we're just well positioned for Medicaid.
Great, thank you.
Mm-hmm.
I had a question, if possible.
Yeah.
Go ahead.
So I am just, I love what you're doing with this, and I'm glad to see you're being successful with it. And I'm ashamed to say that the university here has a food pantry for students, which is one of those things that when you're an educator for a long time, you start to realize that food insecurity among students is really common.
Mm-hmm.
And I'm wondering if you've thought about trying to sort of crack into a market using universities as a way of doing that.
So that's interesting. So we're actually talking to several community colleges right now that are doing a lot of food insecurity work that have pantries on site. And one of the things that's great about our platform and our supply chain partners, so we can work with individuals, we can send that direct to door through that subsidy. They can select their foods and we can do direct to door, but we can also partner with organizations, including universities and colleges that have existing food pantries to be a partner for them, to have higher quality, nutrient dense offerings, to have consistency in what they're offering, and then really be that thought partner with them on how that's displayed and really elevating that experience at the pantry level. I should say that my organization, the nonprofit that I started, again, got special dietary foods into food banks and food pantries. And so I have deep knowledge of what it's like to manage those types of programs. And so we've leveraged that expertise into our offering so that we can really be more than just like the place where you get food, like really making that a strong offering. So yes, we are looking at hunger in college because it is really high.
Yeah, I appreciate that. Thank you.
Yeah.
Yeah, it's it's a challenge. Even Rockhurst, a private university across the street from UMKC, is offering a pantry as well, because their students are also food insecure. Like to maybe just ask a little bit more. This is more of the technical side rather than the practice, and that is, tell us a little bit about how you're storing the data and your relationship with Google and how that's come about, and what it's doing for you.
Yeah, definitely. So Free4 Market is HIPAA compliant. We work with a HIPAA compliant data storage management. So if you can think about our platform as the front end is, traditional e-commerce platform, and then there's a back-end database that stores all of the consumer insights and the health information that gets referred into the platform. And so Google has been an excellent partner, more than just the money. They've been able to be a partner on providing that technical support and expertise. They've also provided Google Cloud credits, which we haven't used yet, but we're in the process of kind of migrating over to that as we prepare to launch our second version of the platform. We're actually still working on our MVP, but it's a process. We know that tech is iterative, so we're working on iterating.
No, it was really great to see you get that contribution from Google. It's not really a grant, is it? It's more almost like an investment. Is that correct?
So it is, they call it an award. So it's a non-dilutive investment. So they're not taking equity from the company. So in that sense, it's kind of like a grant, but they don't want to call it a grant. They said specifically it is an award. It's a non-dilutive funding award. And so it's come with, and there's no restrictions on how we use the funds. We were able to put them to work exactly where we needed to put them to work. But they have then brought on their own partners to help us, not only with technical expertise and other resources, but we have a Google success manager that works with us and is kind of like a liaison between us and Google. So that this is really a true partnership. So it's, looking at opportunities to partner, and, they've recently launched a lot of health equity work. They had their first health equity summit this past year. And so we're in discussions with them now to kind of see how we can kind of integrate our work into some of their health equity work that they're doing.
Oh, that's great.
Mm-hmm.
Well, I certainly appreciated in your presentation the use of a few case studies or example individuals. That was really very helpful in understanding the impact and the nature of the practice. That was really great. So thank you for that.
Thank you.
Other questions from the group?
Well, I have a bit of a strange question, and not to move you from the mission focus, and you're asking Dr. Varon's question, you're saying you need somebody to subsidize it. Have you looked at the non-subsidized market? I mean, I think especially there are a lot of elderly people. I'm thinking of particularly even my mother-in-law, who probably has the resources, wouldn't qualify, but could use a platform such as this to really help them make the purchases. I mean, she's just ordering from Hy-Vee directly and not doing a very good job of meeting her very specific nutritional needs. So have you looked at a non-subsidy market for this, I guess?
Yeah, so we do believe ultimately this platform is helpful for anyone that has a chronic condition where food is part of the standard of care. And I believe eventually we may open it up direct to consumer. But today we are focused, as an early stage company, you have to be very focused on how you spend your time. And for us, we feel like there are people that are building solutions or have built solutions, like Thrive Market is like one that I could throw out. That's really more focused on direct to consumer. We are focused on building for people who have not had access. Like, one of my primary goals for this is really expanding access to the market of healthy foods, where, these are individuals that have always needed access, they want access, but they just haven't been able to get it. So really leveraging that transformation in healthcare to bring access to a market and expand that market share to people who have not had it. And so for us, right now that is our primary focus and our primary goal. But over time, I mean, we do believe that there's a direct to consumer play and that it's going to happen organically, right? So like that subsidy may not last always. It may be a year subsidy. It may not be into perpetuity. And we're already starting to see that people who've come off, say, a study, they continue shopping. And we don't have SNAP eligibility today, but it's one of the things that my team is working very hard on right now, so that once we get SNAP eligibility and EBT, then that will just extend that wallet share, and it'll just happen more organically over time. But we know that this is helpful for everyone, but we're just kind of starting very focused with this market where there is subsidy and there's a large interest in shifting. But when I talked about kind of what's happening at the community college, we're kind of planting some seeds. We know there's an opportunity with institutional purchasing. So again, that's like the community colleges or food banks and food pantries. We sold to some summer camps back east this summer just to bring in some extra revenue and kind of test what does that institutional purchasing look like. So we're planting some seeds and looking at how we can bring in additional revenue as it's opportunistic as an early stage company, but we are very focused on really that subsidized market because we believe it will be huge. I mean, Medicaid alone, and with the changes there, we believe is going to offer a great opportunity.
Great. Any other thoughts or questions from the group? Well, thank you so much, Emily. It's really impressive to see the work that's gone on and your research partners and so on. So you seem to be off on just a great footing, and we wish you all the success and welcome you back to join us as a member anytime that it suits you to join us. I'll keep you on our invitation list and welcome you to join us at any time with adding further thoughts to other things that we're doing.
Thank you. I'd appreciate that.
Oh, you'll be very welcome. So with that, I guess we'll kick out. We'll stop our presentations and wish everyone happy holidays and look forward to seeing everybody in the new year.
Thank you.
Okay.
Thanks, you too.
Thanks for organizing, John. Take care.
Bye now.
Thanks, John. Happy holidays, everybody.
Bye-bye.
Thanks,
Have
everyone.
a great holiday, everyone.